All right, let's talk about 3 easy movements that you can use to reduce the pinched nerve, aching pain that comes down the arm sometimes. So when somebody has that, the most likely source or cause of that is a disc problem in the lower cervical spine. Usually around C5, C6, C6, C7. It can be trapped, shoulder blade. Sometimes it'll come all the way down to like either thumb, right? Thumb and first finger is 6. This is 7. This is more C8. So those specific locations of the symptoms will give you clues as to where it is. But the first 2 are the most important. You have to reduce and move that piece of disc tissue out of the way first to abolish or centralize the symptoms out of the arm. Then we can start doing some strengthening. All right, one that I like to use is a little bit of sliding up and down the wall. So you have to remember that we're going to have to use, likely, some form of lower cervical extension. So in this case, I often show a retraction, but what I want to do is I want to go ahead and retract back, and then as you slide your elbows up the wall, you'll get some extension as well in the neck and the thoracic spine. So just monitor those symptoms into the arm. If it shoots it down, it has to go away once you come back down, okay? So go through that, a good set of 10 to 12, move to the next one. Okay, the next one we're going to do seated. So, sit, you have to make sure your posture. You got to sit really tall, hips all the way to the back. It doesn't work if you sit slouched. In this example, left-sided pain. I want to go in, so partial retraction, not full, maybe 50%. In and then over into that side. I'm trying to put pressure on that piece of disc and smash it down to move it back out of the way. So combination of 2 moves. I know you feel like that pressure, you want to go away from it, but all that does is just open it up and it allows it to take more space. First, try to close it down, in and over, 10, 12, 15, and then move on to the strengthening one. Okay, for some strengthening, I want to work on bringing the shoulder blades back and together because likely not anything, but a lot of times with head forward or down, it's going to be worse. So picture yourself being up tall, slight retraction, and then bringing those shoulder blades kind of back and together. You can do it without any kind of equipment, just pinching the muscles. But if you do happen to have a little bit of a band, you can go ahead and work on pulling those shoulder blades. So tuck here and then rowing backwards. Feel that pinch and then come back out. Okay? Feel that pinch all the way in and then come back out. All right, sets and sets of those all throughout the day. Remember, volume high. Shoot for 60, 70, 80 of the ones that we already showed in order to get that pain up and out of the arm.